Hi everyone, today I'm here with Dr. Rodriguez, but to me he's just Dad, and I'm going to be asking the tough questions, starting with what is a dental implant?
That's a great question. Think of a dental implant as a permanent way to replace a missing tooth. It has three parts: a tiny little titanium post that acts like the root, then there's a middle connector part, and then there's the crown that goes on top that makes it look like a natural tooth. It doesn't have anything to do with the adjacent teeth next to it, so it doesn't affect the nearby teeth. It lets you eat, smile, and speak just like normal. An implant cannot get a cavity and can last a lifetime. There is no better way to replace a tooth than with a dental implant.
So I know you like talking about implants, but you used to not place them.
That's right. Dental implants are kind of advanced procedures, and new dentists only learn how to put crowns on them, not to actually place the implants. Early in my career, whenever a patient needed a dental implant, I would just send them to a surgeon. I assumed the surgeon had to just place the implant where the bone was without considering really how the final tooth needed to be. But then, about 10 years ago, I hired an associate who just finished a very intensive year-long residency on surgical placement of dental implants. We shared an office space for 2 years, and sitting next to him, I absorbed his techniques. We would talk about cases and really go into the depths of what we were doing when it comes to placing dental implants. It was an advanced process, but I really enjoyed it, and I took his techniques and I ran with it, and it changed everything for me.
What changed?
Sure. I realized that to get the best result, the person making the final crown needs to be the one planning exactly where the implant goes. We call this crown down, meaning we start by considering the ideal final position of where the crown should be and working backwards to determine where the implant should go, versus letting the implant placement dictate how the final crown looks. Crown down implant planning is done by doing the surgery virtually, meaning I use 3D x-rays and digital software to evaluate every aspect of an individual's situation. At the end of the planning phase, I then 3D print a template snaps onto their teeth to help guide my tools so we can place the implant precisely and exactly where I planned. It is challenging computer design work that doctors simply aren't taught in dental school. It took me years to become proficient at it, but I enjoy it and I find it rewarding.
Are you the only doctor doing it that way?
No, there are other clinics doing it that way. But what I've seen as I've gotten more advanced is that as I realize most of the other clinics doing them are actually outsourcing that step. They'll outsource the planning steps to a dental lab technician or an artificial intelligence tool, and you can get a good final result, but it's just not as good. It's like getting a book report instead of reading the whole book. You get the important points, but you really don't have the full understanding of the way the whole thing works. So by doing the process in-house, by doing every little step from the planning phase into the placement, I am much better prepared and fully understand my patient's situation.
So you became a whiz at it.
Exactly. Pretty soon I realized I was having success with even the most challenging implant cases. And there became a point, maybe 2024, 2025, when I realized that there is no specialist I can send my patients to who can place a single unit implant with any more precision than I'm doing right here at Inman Park Dentistry. Whether they're a general dentist or a specialist, it's a level of care I'm really proud to offer right here.
Is it scary because some people get scared going to the dentist?
I mean, I understand people get nervous about these things, but because of the advanced techniques and the digital planning we use, the placement is very quick and gentle. Most patients tell us it was much easier than they expected. We walk you through every single step, and we're with you the entire way.
Well, you convinced me. If I need a tooth replaced, I know who to call.